Picture a stone chamber in ancient Egypt, sunlight filtering through narrow windows onto a table of gleaming copper instruments. This isn't a tomb or temple, it's one of humanity's first operating rooms, and the tools laid out before us would look surprisingly familiar to any modern surgeon. The year is roughly 1600 BCE, and Egyptian medicine is already a sophisticated science. While much of the world still believes illness comes from angry gods or evil spirits, Egyptian physicians are taking a remarkably different approach. At the heart of this medical revolution is the Edwin Smith Papyrus, the world's oldest known surgical treatise. Written in ancient hieratic script, this remarkable document describes 48 cases of injuries, fractures, wounds, and tumors, along with the tools and techniques used to treat them. But these aren't just crude attempts at healing. The level of precision and sophistication would astonish us even today. Take the ancient Egyptian scalpel, for instance. Crafted from copper and bronze, these cutting tools were carefully shaped and sharpened to an almost microscopic edge. The handles were weighted and balanced for precise control, a design principle still used in modern surgical instruments. But it wasn't just about cutting. Egyptian surgeons used a remarkable array of tools, each designed for specific purposes. There were copper needles for suturing wounds, forceps for extracting objects, and probes for examining injuries. They had bronze hooks for lifting tissue, spoons for mixing medicines, and even specialized saws for trepanning, a delicate procedure involving the skull. The Egyptians' understanding of wound care was equally sophisticated. They recognized the importance of cleaning injuries and preventing infection, using honey, copper salts, and other natural antiseptics. Their surgical dressings were made from linen carefully woven to different thicknesses for different types of wounds. Some bandages were even impregnated with medicines, an early version of modern medicated dressings. But perhaps most remarkable was their approach to documentation and diagnosis. The Edwin Smith Papyrus reads like a modern medical textbook, with each case following a clear, systematic format: examination, diagnosis, treatment, and prognosis. For each injury, the physician was instructed to observe specific symptoms, ask particular questions, and follow precise procedures. Consider this passage describing the examination of a neck wound. If you examine a man having a gash in his throat, penetrating to his gullet, and he speaks with difficulty, then you are to say concerning him, one having a wound in his throat, penetrating to his gullet, an ailment which I will treat. This methodical approach to diagnosis and treatment was revolutionary. It established the fundamental principle that healing should be based on careful observation and documented procedures, not on superstition or guesswork. The Egyptians even understood the importance of specialization. Their physicians were divided into specific fields, some treating eyes, others bones, others internal ailments. They had dedicated surgical tools for each specialty, just as modern hospitals have different departments with specialized equipment. But what truly sets ancient Egyptian surgery apart is its humanity. Despite their technical sophistication, Egyptian physicians never lost sight of their primary goal: healing people. The Edwin Smith Papyrus includes not just technical instructions, but also guidance on patient care and comfort. Physicians were taught to speak gently to patients, to explain procedures, and to offer encouragement, practices that remain crucial in modern medicine. Think about the legacy of these ancient innovations. When a modern surgeon picks up a scalpel, they're holding an instrument whose basic design was perfected over 3,000 years ago. When they examine a patient and document their findings, they're following a protocol established by Egyptian physicians. When they select specialized tools for specific procedures, they're building on principles laid down in the time of the pharaohs. The influence of Egyptian surgical tools and procedures extends far beyond their time. Their systematic approach to medicine, their emphasis on observation and documentation, and their development of specialized instruments formed the foundation of modern surgery. They showed us that healing is both a science and an art, requiring both technical skill and human compassion. Today, in operating rooms around the world, surgeons use instruments that would be recognizable to their Egyptian predecessors. While the materials have changed from copper to stainless steel, and while modern technology has added new capabilities, the basic principles remain the same. A scalpel is still a scalpel, a needle still a needle, and the goal is still the same: to heal with precision and care. As we look back across more than 3 millennia, we can see that ancient Egyptian surgery wasn't just a collection of tools and techniques, it was a revolution in human thinking, a shift from superstition to science, from guesswork to methodology. In their careful observations, their precise instruments, and their systematic procedures, Egyptian physicians laid the groundwork for all that would follow. So the next time you see surgical instruments gleaming under bright lights, remember those ancient copper tools in that stone chamber. Remember the careful hands that wielded them, the minds that designed them, and the legacy they left us. For in every modern operating room, the spirit of ancient Egyptian innovation lives on, continuing to save lives and ease suffering, just as it did thousands of years ago.